Hello everyone, my name is Dr. Michael Mansouri, and I'm here today to explain to you guys about single tooth implant. I know some of the most common questions I get from my patients are, how much is this going to cost? What is involved with the procedure? And is this going to hurt? So I'm going to answer all of those questions. We're going to have a link at the end of this video that you guys will be able to follow to get some pricing guide and structure. We'll be happy to provide free consults. And I'm going to explain to you guys what a procedure is involved. Usually when a patient comes to our office, either they currently have a tooth that is problematic that has to be extracted, and we'll discuss implant, or they've lost a tooth for several years and they're thinking about having that tooth replaced with an implant option. Both of those are something that we do very often, and it's quite simple. Of course, every situation is different, but I'm going to talk to you guys about the basic general concept. So let's imagine you come to our office with an existing tooth that maybe it's cracked or fractured and it has to be extracted. So what's going to happen, we're going to remove this tooth, and usually we will evaluate it to see if the best time to place an implant is either during the actual after extraction, or if the situation allows, maybe a couple months later. What an implant is a single titanium root form screw that is placed in the part where the tooth was extracted, or in the jawbone. The most important part is we have to allow this implant to stay sleeping under the gum or stay rested so it can fuse with the jawbone and become strong. We do not want to put a crown on it right away, because crown is going to put a lot of pressure on that implant and essentially increase the risk of that implant failure. So what's going to happen once the implant's in place and 4 months has gone by, you will come back, we'll place an adapter over it, which is called an abutment. This adapter will be able to support a nice natural crown that will be able to restore it to aesthetic and function of its original tooth. Now, let's say if you're one of those patients that has lost a tooth maybe for a couple of years. What happens when you have lost a tooth for a couple of years, you're gonna have the bone around the jaw shrink. So this bone kind of comes down a little bit more in between. And as a result, when we wanna place an actual implant in between, we may have to supplement some additional bone around it so it can stay dense and strong. And this is something we commonly do during or before the implant placement. The timeline that most patients ask me how long it takes for the implant from start to finish usually is 4 to 6 months. Now, that time is when the implant sleeps and rests and becomes strong with the jawbone, and then we'll fabricate a crown to function like a natural tooth. What makes it unique in our practice is that we have the oral surgeon, the general dentist, all in one office, which will allow us to be able to place an implant, look to see what would be the best position for the implant aesthetically when we want to restore it with a crown. And that way, the patient really gets two doctors looking at the situation rather than one at a separate office and then individually. So if you have any questions, please contact us. We'll be happy to discuss your particular situation with you individually.